Hey guys, so here is my case study on carotid body tumors. So let's get started here. So what exactly is a carotid body tumor? So these carotid body tumors are paraganglioma, which is a rare, benign tumor usually that is beginning in the nerve cells and it disperses throughout specific areas of the body. They are driven by the genetically mutated chemoreceptor cells. And as we can see over here, they're typically located in this carotid artery bifurcation here. So now we're going to talk about the pathology of carotid body tumors. For us to determine what a carotid body tumor is and how it functions, it's important to understand what the carotid body exactly is. So this carotid body is a small group of chemoreceptors that are located at the bifurcation of the carotid arteries. This is the area where the tumors are formed, like I said before. And this area is a cluster of two cell types. So there's chemoreceptive cells, which are type 1, and then there's the supporting cells, which come from the neural crest cells. So this carotid body tumor is formed by hypertrophy of this area in the tissue of the carotid body. And one thing to remember that's really important is that these carotid body tumors are very vascular. They got a lot of vasculature to them. Alright, so these are the types of carotid body tumors, and as we can see here, we've got this type 1 first. So this is the one that's, this tumor here is not attached to the carotid arteries, and it's typically a lot smaller. Type 2, we've got moderate attachment to these carotid arteries and the encasing of the carotid arteries as well. And they're usually moderate in size. So we've got these images up here as well that we can see how this type 2 is starting to encase those carotid arteries. And then for type 3, we have a complete encasement of these carotid arteries here, and these are usually very large in size. So then we get to the etiology or the cause of these tumors. They're typically sporadic, and that occurs in 79 to 90% of the cases. Then there's also genetic mutations, and these account for 10 to 30% of the cases. These mutations can be inherited from family members and passed on from generation to generation. Also, one other thing that they can be caused by is the environmental factors and hypoxia. And one of those environmental factors is hypoxia, low oxygen levels. So living at high altitudes for long periods of time and decreased oxygen levels can result in this formation of a tumor. So the course of the disease. So typically these carotid body tumors are slow growing. They're usually benign, however they can be malignant. And patients typically can survive for long periods of time without undergoing surgery. And some people may not even notice that they have them until there's a palpable mass on the side of their neck. So now we're going to move on to the diagnosis. So they're usually first diagnosed through physical examination, and then they're further examined with the use of imaging, medical imaging. So ultrasound with the use of color Doppler is usually a good visualization of the carotid body tumor. And I have some images later on that can demonstrate the ultrasound use of that. Then we got CT with also CT angiograms that are really good. MRI and MR angiography as well. So these modalities are selected based on the initial assessment. So if the doctor thinks that one modality is going to show the pathology better, then they'll go with that one first. It's not uncommon to start with a CT that has contrast of the neck, and these CTs can really show the vasculature of the carotid body tumor, since they're very vascular. So that's there. So differential diagnosis. These carotid body tumors can often be diagnosed wrongly as lymphomas, thyroid lesions, aneurysms of the carotid arteries, salivary gland tumors, or cysts. And these are just some of the things that we can see that aren't a carotid body tumor but can be misinterpreted as one. Now we get to the treatment procedures here. Once the tumor is detected and characterized using the modalities that we listed earlier, the patient and the physician need to decide if it's it needs to be surgically removed, or they can decide to take a more conservative approach and treat it in different ways. So the conservative approach would be to monitor the changes, not really do any surgical procedures or anything like that, and just monitor it and keep an eye on it, really. The next one is radiation therapy can be used. And then lastly, like we've mentioned, surgical removal, which is pretty common. So now we're going to go into the case study. So we had a 40-year-old woman that was admitted to the hospital with left anterior neck mass, and she's had the mass for 5 years, and there's been no evidence of hoarseness or dysphagia, trouble swallowing. So for lab values, I didn't get the particular lab values for this case, but usually a UA is performed and can be tested for catecholamines, and if they're elevated, it can correlate to a possible carotid body tumor. Fine needle aspiration and biopsies can be helpful, but we need to keep in mind that this is a very, very vascular structure, and it would have to be very serious and done by a surgeon or someone that can do it very well. Let's see what else. So then we go to the symptoms. So she had neck pain, occasional fainting, dizziness, and she was short of breath. Short of breath goes along with that hypoxia, like I mentioned earlier. The physical examination, the left pupil contracted more than the right. This is called Horner syndrome, which is an indication of a disruption in the nervous system. She didn't have any other neurological impairments, and they did a scope that showed abnormal movement of the left vocal cord, which we'll find out later was because of the carotid body tumor pushing on that. So now we get to the images. So these two images on the side here are the images from the case study, and we can see that this is a contrasted enhanced CT showing the ICA, the ECA, and then around here is that big mass that we can see here. And this tumor was diagnosed as a type 3 because it's completely encasing these two carotid arteries. Here's some more images with some 3D reconstructions in the coronal plane. We've got this jugular vein coming up here, and we can see that it's compressed. We've got the mass here, the left common carotid artery, and then just the aortic arch here to kind of give you a reference of where everything's at. So the treatment for this, she didn't have to go to surgery and have it removed. We've got the pictures over here that show that. So parts of the ICA and ECA were also removed with it. So they ended up having to do a graft, and we can see the graft here, the white piece that they grafted in. Then we get to the prognosis. There was no cerebrovascular events after the surgery, and the biopsy came back and concluded that it was benign. Post 6 months after the surgery, she could speak and swallow normal, so that was good. And then we get to the discussion here. So the carotid body tumors are typically located at the bifurcation of the carotid arteries within the carotid body, and arise as a slow, benign tumor. Surgical removal is recommended as they can grow and cause many complications. Early detection is key, and removal of it to ensure the surgeon's ability to remove it completely without any complications. So like we mentioned, the CT, CTAs and MRIs and ultrasounds are very helpful in early detection and diagnosis of a carotid body. Lastly here, we're going to just show some additional images like I mentioned. I wanted to show an ultrasound with color Doppler on, showing the carotid artery coming in here and this carotid body tumor, black here. So that's kind of something like we would see doing a vascular study of this. And then this one over here is just an angiogram showing a carotid body tumor with some good enhancement. There's just some really cool images here. And I think that's it. Just some references here. Thanks for listening.